have a wonderful big panel of foster care experts here to shed light on just what's been going on with foster care in Michigan. So it is time for you to meet them, beginning with Stacy Bladen, who's Interim Executive Director at Children's Services Agency, Michigan Department of Health and Human Services, a longtime MDHHS employee who has worked a variety of child welfare roles. And Stacy brings a wealth of experience to this position. She's worked more than 25 years in child welfare positions, including foster care, adoption, and as a Children's Protective Services employee. And by the way, we must note her last day before embarking on a very well-deserved retirement is today. So Stacy, we want to congratulate you on a wonderful career, and we want to thank you so much for sharing this very, very special day and making time for us.
Thank you, Cynthia. I appreciate that.
You got that. You have that glow. I did it in December of 2019, and it's a wonderful new chapter that you're about to embark. We also want to welcome today Brenda Baker Mbaki, who's currently the CASA Director under the umbrella agency of Care House of Oakland County. She has more than 35 years of child welfare experience. Brenda's been the Executive Director of 2 agencies offering direct services to children and to families. And she's worked in the areas of foster care, licensing, delinquency, residential treatment, and adoption. Hello, Brenda. So good to have you with us today.
Hello, Cynthia. Glad to be here.
We meet now Clarkston Morgan, who is Chief Operating Officer of W4 Construction Group. Through his influence as a COO, Clarkston empowers African-American families to adopt and to foster children. He and his wife, LaKendra Morgan, have taken up the call to adopt 2 children after fostering 3 kids. Clarkston's also heavily involved with Christian Alliance for Orphans, where he chairs the African-American Leadership Council. Good morning, Clarkston.
Hey, good morning.
Great to see you. I'm so excited to hear what you have to say. And we welcome Jennifer Stevens, who's Director of Child Welfare at Samaritas. She's worked in child welfare for over 20 years in a variety of roles. Jennifer is passionate about helping families through tough times using strength-based and innovative approaches, and she enjoys working with her team to develop their skills in providing services to families. And Jennifer is a foster and adoptive parent. Jennifer, hello.
Good morning.
Good to see you. We want to welcome Katie McEwen, a former foster child and Samaritas foster parent recruiter. Now, Katie brings a very, very unique perspective to this role because of her experience as a foster child. Because she was part of an abusive and neglectful relationship with her mother, Katie entered foster care when she was only 5, and then she was in and out of foster care until she was 14. Then she went into foster care and stayed until she aged out at 21. Katie truly understands the need for foster homes for teenagers, and she strives to use her experience and her orientations and social media approach to give teens who need it a safe and loving home. Katie, welcome to the panel.
Morning, thank you.
So good to have you here. And we have Jessica Rogers here. Jessica and her husband, Tom, are exceptional teachers who became licensed Samaritas foster parents in the heart of the COVID-19 pandemic. Now, Tom was going to be with us today, but he had to teach us this morning. Jessica joins us from her school. We might hear kid noises or announcements because that's what schools are about. They work in their local education system. Tom is a literacy intervention specialist, and Jessica is a special education teacher, and they care for 2 school-aged youth. So we are so happy to have you with us, Jessica.
Good morning, everyone. Glad to be here.
So what better way to mark Foster Care Awareness Month than to gather virtually with all of you to talk about the state of foster care in Michigan, particularly after the 14 months, I think some of us say it probably feels like 14 years that we've been living with this COVID-19 pandemic. We want to focus on just how we are doing in providing a safe and caring home for the thousands of children and teens in foster care in Michigan until they can hopefully be returned to their families. Stacy Bladen, the Michigan Department of Health and Human Services, tells us that there are some 13,000 children in foster care and some 300 who still need a foster or adoptive family in Michigan. What do these numbers tell us? What kind of trend have you seen? Is the need for foster care going up? Is it staying stable? Stacy?
Yes, thank you, Cynthia. I was just getting off mute. Thank you for that question. And you know what? I want to correct you, and I'm happy to correct you in the direction that I'm going to correct you in. And that is, I just received our April numbers for kids in foster care, and we're at 11,313.
Going down.
You opened up by asking about 13,000, and this just tells you that we have each month for the past, I want to go back a couple of years, we've been decreasing the number of kids that we have in our foster care system. For those who've been around a long time, back in 2005, we had close to 20,000 kids in foster care. We have, through myriad efforts, been able to decrease our numbers in care down to what it is today. And I'd like to see it go even lower. But certainly there are still kids that need out-of-home placement because of their situations. And we need foster parents, we need caregivers, and we need others who would step up in whatever way they can to help support kids who do need temporary out-of-home care, and their parents who are trying to meet the challenge in order to get their kids returned to them. And so we do still have a great need, and we have kids coming into our system every day that need us, depend on us, and we will continue to serve and improve programs to do the very best we can by those kids and families.
Jennifer Stevens, how have foster care programs like Samaritas evolved or changed over this past year of COVID in a sense of addressing the need while being also responsive to COVID safety precautions?
Well, we've definitely had to put in a lot of safety measures with this pandemic, and it was an immediate need. Right? 14 months ago, we were all told that we needed to stay home and stay safe. And our teams just did an incredible job of transitioning from working in their office space and working directly with families face to face to doing it remotely. I've been really impressed with their efforts to do that, and we've had to continue to do some of that remotely. We have been able to go back to some face-to-face with some safety precautions. Obviously with that, wearing face masks, using the appropriate PPE, asking the questions, making sure we're sharing if we are feeling a little bit under the weather, and understanding each other when we're doing that, and being very, giving everybody grace with that. It has been a challenge for sure to run the programs this way. We used to, and Katie can probably talk a little bit about this, we used to be out in the community, talking to the community about the need for foster families. And we can't get out in the community and do that these days. So we're using a lot of social media and, just the media in general to try to inform the community of that need. There's still, as Stacy was saying, a great need for those families that can help out either by fostering, by adopting, or just being supports to the foster care system.
Katie, I'm sure you had to up your game in recruitment.
Oh, most definitely. It does look a lot different than previous years. Definitely using social media and media, as Jennifer has said. It's been a unique perspective, that's for sure.
Is your organization seeing any data or any trends that worry you or hopefully encourage you in supporting children in foster care, its impact on foster parents? Stacy, what are you seeing at the state level?
As I said, we're continuing to see a downward trend in kids coming into care, which is really good. What we look at is our exits to entry ratio. And I'm happy again to say that our exits exceed our entries into foster care, and that's an important indicator. We are as well seeing a decrease in our placing of youth in congregate care settings, which is really important to us because we know research shows kids do best in family-like settings. So we want to keep them in family homes with relatives or foster parents whenever possible. So we've seen a very precipitous decline over the past 2 years, but certainly about 50% just in the past year and a half of placing kids in congregate care. We have just above 500 now who are in that setting, and we were over 1,000 a couple of years ago. So again, a positive downward trend that we're seeing there as well.
And what's causing that positive downward trend, do you think?
That's a great question. I think that we have put the call out to our staff to be very deliberate in making those decisions and to exhaust services in the community, community-based mental health services, in order to be able to safely keep a child in a family home, we have many wonderful relatives and foster parents who stepped up with supports from community mental health organizations to be able to keep the kids safe in a family home. And that really prevents a need to escalate the child into a congregate care facility. So a lot of effort around the state, both in terms of our caregivers, our community mental health partners, and our own staff, public and private, in making those plans, individualizing those plans for kids and families so that they can be successful.
Brenda Baker Mbaki, what concerns do you have related to foster care that are a direct result of this pandemic?
Well, there are a number of concerns I think that all of us have, because with all of the mandates and restrictions, how we interact with clients has been directly impacted, both I think with workers and the CASA program. Not being able to see your clients face to face has been very difficult, but we have had to get very creative in terms of how we engage. And as much as I think we're all zoomed out, I think we will be zoomed for life, because many of these social media outlet platforms that we have utilized during this time will not just go away, even when we return back to some sense of normalcy.
Yeah, that is we really have hit such an inflection point in our history. We truly have. Jessica Rogers, as a teacher, you are a mandated reporter. Michigan has that law, as do many states. Remind everybody just what that means.
It means if you suspect any form of abuse, neglect, you need to report it. And that's been hard being a teacher now that your district may be virtual, and we just don't get our eyes on the kids as much. So it's one of those things, you just really have to be observant and in tune with what's going on. This is a hard time for a lot of people. So understanding, how to best advocate for your students.
Can you, as a teacher, and have you had anecdotal evidence from fellow teachers that you are indeed able, even if it's through a screen, able to pick up on a fact that a child may be at risk?
Yes, and typically at schools, there's a process and a team of individuals who know the students, and you can collaborate with to make sure that the students are getting what they need and that they're safe.
I wondered if the pandemic is keeping potential foster parents from taking that step forward to volunteer. And Jessica, I'm going to continue with you, because you and Tom became foster parents right in this pandemic year. Why did you do that? Why now?
It kind of just happened. So in February of last year, Tom and I were like, oh yeah, we want to be foster parents. We see a need. And then we heard everything that was going on in the world, and we asked our licensor, like, is this gonna happen here? And she's like, I don't know. And the next time we saw her, everyone had to wear masks, and
it happened. Yes.
Yeah. And it was hard because our world was changing and we weren't sure what was going on, but at the same time it was kind of convenient for our busy schedule, because in the past you would maybe have to drive to all these different trainings, and being able to do it virtually, it made it so much more convenient for us to be able to do the trainings versus getting it just taking longer. And the whole time we were like, this is going to be hard, but for kids that it's going to be that much harder. So it was one of those, we just realized how resilient kids are, and the fact that if you have great supports, you can do it.
Everybody's been we hear story after story of what it's like for families just kind of squished into a house together. Are there extra strains? Has it been like that for you as you kind of incorporated these youngsters into your home?
Yes, it's very hard when you're trying to teach a Zoom and you're at home and they're in their Zoom classes, but they might have a break and they're coming in while you're in the middle of teaching, and you just have to be like, so it's been hard and it's been a challenge. But at the same time, I feel everyone's been understanding. Everyone's trying to put their best foot forward. Teachers in other schools that our kids are at and that we're teaching. And I think that's the biggest thing is being flexible and understanding, and also advocating for yourself as to say, right now I need this room to myself. You need to turn everything down low and, in 20 minutes, go crazy. But right now I need my own space in order to be successful.
Katie, as a recruiter, how are you trying to overcome the challenges of this, of the pandemic?
I think it takes very unique timing. I kind of agree with Jennifer, or not Jennifer, Jessica, sorry, that a lot of my foster parents that are coming through orientation are enjoying the virtual aspect of becoming a foster parent, just because it is kind of more like meet them where they're at type of thing. Mm-hmm. They don't have to drive to orientations, right? So they don't have to, drive all these trainings, and they can kind of be in their home and kind of enjoy like their family setting as well as becoming a foster parent. And then when it kind of comes to recruitment, I've actually found that social media has been like our best friend through this pandemic, just because we have been able to utilize that in a way that I don't think I was utilizing it the best way before, and understanding all of the things that we could accomplish with social media. So I think it's really nice because it's able to maybe hit more people and kind of just meet them where they're at, in the sense of maybe I might be at an event, right? But maybe this person can't attend this event. But if they see a Facebook Live, they could be like, wow, I was really interested in that. And now here it is. And I can watch it and learn all these information things that I didn't have time to that event with.
This past year was marked not only by COVID-19, but by a country struggling to face the reality of racial inequities and racial injustice. Clarkston Morgan, you're focused very intently on empowering African American families to adopt and to foster children, particularly dads. Where do you see racial disparities in the foster care system writ large, and how do you think we should rectify them?
Yeah, that's a very loaded question, right? There's historical positioning of understanding the area of foster care and adoption, and in essence to minority communities where you've grown up where there was Big Mama, right? We say Big Mama, Grandma, who's been doing foster care before there was a system. In more Hispanic families, the grandmother has been the same. It's always been this more cultural positioning that the children are our children. Whether it be little Ricky from next door that used to play and his family's gone through things, we're going to bring Ricky in, let's eat. And we took him in. And so there's been this understanding of that if we have this system culturally connected with each other, then where's the need for government, right? And there's there's areas where there's distrust, there's areas of pain, that there has to be an acknowledgement of some historical position before we can go forward. If we don't have that space to say that there's a history of what we need to acknowledge, that there's fears. There's a fear that if I go get children, they'll take my children because you see them, I'm not maybe living at the standard of what it should be reasonable for living, right? But I think there's the part where I understand is the empowerment. And my wife and I were in that position where we did family planning and we looked at ourselves from, we want to have kids to, are we good enough parents for foster children? Kids that are in situations that are broken, that never asked to be there. They never asked to be in a broken family. They don't even know they're in a broken family because it's all they know. And to them, it's wholeness, completeness. And yet you're coming in a system. They see a system ripping them apart from what they feel is comfort. And it's one of those things that came to us as our leaders. We have mentors and individuals that says, I believe you can do it. My wife came, she says, we can do this. And we started doing it. We started helping out and recognizing what little we had was huge in the hands of children and look at it like, I just want a loving family. I want somebody to just love on me. I'm going to be difficult. I'm going to yell. I'm going to scream. I'm going to test you and see if you really love me, because my other foster parents said the same thing and then they left me. And it's then being willing to go through the battle saying, my love for you is greater than the turmoil you've been through. And they want to ask that question, can you love me in my difficult moments? And you can help other parents, and that's being in that same space, helping other fathers, helping leaders, as a leader within my church and community, helping other single mothers to say, I want a child. I want to be able to foster. I want to be able to adopt, and ask the question, are you willing to wrestle with your weights, but through a child, right? You have adult weights that children are dealing with, and they don't know how to do it. And we advocate for parents saying, let's be real, right? Because I don't want you to get a child that's innocent, that didn't ask to be here, and then you give up on them, right? And then they feel somebody else that doesn't love me. And so you get with other adults and you say, you know what? Hey, you really going to do this? Let's ask some really serious questions, right? Are you willing to take children that look like you, but that don't look like you, that haven't been through your situations, and you can love on them? And been able to walk parents through this. A lot of African-American parents and it's single African-American mothers. This is the great thing. Just as much as fathers that I work with as mothers that say, you know what, I don't have any children, but I'm hungry and passionate to love on a child. I see this and I want to be a solution. So it's been some work, but it's been very valuable. And it's something that is going to take continuous, this team, this communication of saying, how can we empower families to do better? And then we go out and actually be boots on the ground to do so.
When we all met the other day to kind of introduce ourselves, Clarkson, you brought up a very challenging topic of cross-racial placement. And you know, we see children of color being placed in foster homes with white families. Are we seeing white children being fostered by parents of color?
You know, that I brought that up. That was because of the testimony of time my wife and I went through. Coming straight out of being licensed foster parents, you get your license right from the state of Michigan, you're excited. And then there's this time where you get children, and we said, we'll take any child because we were just knowing that there was children in the homes. And our first sons were Caucasian, right? Now to us, it wasn't anything because we loved on everyone. We've been outliers in areas of our life when we're the only African-Americans in jobs and schools and things of nature. So it didn't matter to us. But I found out that it mattered to society to see Caucasian parents with African-American children was acceptable. But to see African-American parents with Caucasian children, oh, it was a battle. And it was tough. I'm not going to lie to you, because you see me walking with my sons, right? We just automatically say my sons. And they'll think, oh, he's either their coach. They ask, are you their coach? Or you're dating their mom, right? And those are we're trying to reason with this. And the same thing with my wife. But when they saw us both together, they said, well, what are you doing with them? You're doing what everybody else would do with kids. Love upon them. You give them a home. You're trying to treat them with the best love and show them that what they've been through is not their future. And recognizing society, and thankful that it's transitioning, but it still has to transition. It's going to take some more work for parents that were like my wife and I, that are willing to step out and say, I'll take any child, right? And then be willing to deal with the public communication that may not be fully accepting, but it's for the best interest of the child.
I want to toss this question of racial disparity in the foster care system to the rest of the panel. Who has something else they want to weigh in with?
I will, Cynthia. This is Stacy. Children of color are disproportionately represented across our child welfare system, both in terms of who's reported to centralized intake from mandated reporters and others who would call, all the way through lengths of stay in care. We know that multi-race kids and Hispanic kids are less likely than their white counterparts to be placed with relatives in care. Why is that? And we also know that Black children are more likely to be disproportionately placed in congregate care settings. And so we're taking a very close look at all aspects of our system at DHHS, together with our private partners, We're instituting training, making efforts to not just address implicit bias, but to help folks understand systemic racism. Our goal is to eliminate racism in the child welfare system because it exists and it has historically existed from the very beginning of the system being created. And so we also know that our staff need to look like the populations that we serve. And so we are making concerted efforts with a new office at DHHS to hire diverse applicants and make sure that they are, in all areas across the state, serving our kids and families. And there are other things that we can do looking at our own data consistently to look for opportunities to improve outcomes for kids and families, regardless of the race of the children or the families. But we are certainly recognizing this as a problem and making efforts to address it.
Brenda, what have you seen in your years of working for the welfare of children?
I think Stacy summed this up very well. We have certainly seen disproportionate numbers of African American children coming into not only the system in Michigan, but across the United States. Mm-hmm. It is a pattern. And I feel good about some of the recommendations that she's making for the state to begin to address these issues. It's certainly, we've had multiple ad hoc committees throughout the years to address this very issue, and then walking away and nothing is ever resolved. So hopefully we will see a difference. But I also think it's important that we teach the foster parents or caregivers who have children of a different race how to respond to those children, not just to their skin care or their hair care, but to their culture. Are you taking them to the African American Museum? Are you taking them to a church that is predominantly Black, where they are able to see people who look like them, especially when they're living in neighborhoods with people who do not look like them? It's important that we make those attachments.
How do we better support the at-risk biological family? So perhaps things can be improved to the point where a child doesn't have to be removed and put into foster care.
I think that is an interesting question, and one that I've talked about throughout the years. Mm-hmm. I've always said, what if we took the same resources that we put into foster parents and took those resources and put them into birth families? What differences would we look at or would we see with children who are coming into this system?
So it's on. Yeah.
Think about it.
Yeah. Yeah. And that is exactly, Cynthia, the direction that we're headed in Michigan. And we're driving there with urgency because you're right. We should be putting resources into helping to support families before maltreatment even occurs. I mean, most of the reasons for kids coming into care have to do with neglect, and it's oftentimes conflated with poverty. There's so much that we can do before maltreatment even occurs. And it's incumbent upon community partners, not just the state, DHHS, but everyone in communities, families like we have on the panel who reach out and support in whatever way they can to help meet the needs of families who might be experiencing challenges. That could be all of us. We need to normalize that support and implement evidence-based services up front so that families can access it right in their own communities before getting the call to Children's Protective Services.
Katie?
I think that's a very good point. I know personally, if there were some things put in place, maybe in my personal life, things maybe would have been a little different outlook. I think some resources, and normalizing that it's okay to be asking for help. Like you're not going to be ridiculed for that. And I think sometimes working with birth families and even just with like families in general, we see that the families are often scared to ask because there are these very big myths around asking for help about some things. Like, oh, you're going to ask for help. Okay, well then, you know what? Then they're going to know that you need help and you can't take care of your kids. Or there's going to be things when that's not our purpose at all. We want to make sure that we're helping you for whatever reason you need help with. And so I think normalizing that is definitely something that needs to happen, because that way we can have that open flow of communication with families all around, so we can be better helpful for everyone involved.
Yeah. If I may, I agree with what the rest of the panel has stated, and I think there's the part where the extension of partnerships, strategic partnerships. I would say, for example, with churches, people are coming to their pastors and their leaders being most vulnerable. They've gone and say, we need money, we need assistance, and having those pastors have a resource directly coming back to Samaritas and says, we have a connection with Samaritas that we can get you assistance. And so what you have is an opportunity of need, directly them needing it is a solution. Because most times we don't remember that there's someone that can help us. We just think about our situation. And when someone that's trusted, like a pastor or a leader within a faith-based community, whatever type of, denomination, whatever it is someone worships, but that person is trusted. And so when they can have the resource right at their fingertips, and say, let's get you help right now. I want you to call, Brenda. I want you to call Stacy, right? And then what's going to happen is they're going to walk you through this. I want you to call Katie. And they're going to call right away. And before anything blows up, you're preserving what that opportunity can be to save that family for something greater.
I have to imagine, Jennifer Stevens, as this year has presented these challenges, certainly including foster families and kids in foster care, you've got mounting challenges and priorities that are evolving. What new or enhanced services has Samaritas tried to provide these foster families and kids? And particularly wondering how volunteers and people who care can help with that.
Yeah, well, just to even piggyback on the question that you asked previously regarding prevention services, as Stacy said, there's an effort across the state of Michigan to put our resources into prevention services. And so that's one of the things that Samaritas has done, is really jumped on board that ship and said, this is where we need to be. We need to be preserving these families rather than trying to reunify them later. It causes so much more trauma for the children to be removed from their families. And there are times that needs to happen. But if we can preserve the families in the first place, it'll benefit everybody. So we've really jumped on board and worked towards contracts and getting those. And we've had some great evidence-based contracts across the state now. So hopefully we'll see some more trends with those foster care numbers coming down even further over the next few years. But we definitely, when you're talking about volunteers, not everybody is cut out to be a foster parent. Jessica and Clarkson have talked about the struggles of becoming a foster parent, and you got to have that passion. I'm a foster parent as well, and it is very difficult to do because you are taking in a child who has experienced some trauma and some very, as Clarkson said, and he probably worded it much more eloquently than I will, but carrying that weight that grown-ups have to carry, but they're children and they're vulnerable and they're carrying those weights. And so not everybody can handle that. It's a very difficult job. We need foster parents, so I'm not discouraging people from doing it. Certainly, use your support networks as both Jessica and Clarkson referred to having support networks. So if you've got the support of your community, then it's a much easier process. So if you just don't feel up to that challenge, there are so many other ways to support children in foster care by volunteering. We have families and businesses who have opened up space to store some donations or to gather donations from their communities. Because a lot of times our foster children come into the foster homes with nothing except what they're wearing. And sometimes, I have one child that came in that they were wearing clothes that were a couple sizes too small. And that's all that she came with. So, we oftentimes need things very quickly for those children in our homes. But also being a volunteer, I think a mentor would be great, not just for the children in our care, but also for the biological parents, which I don't think we utilize near enough in this system. But we forget that we're not just working with the children, we're working with a family. And foster parents are oftentimes mentors to those families, the biological families, but we need a community that will surround them and be good mentors to them. So there's a number of different ways I think that you could volunteer your time. And we'd be willing to discuss if people have other ideas. We'd be happy to hear ideas and to discuss how you would best be able to volunteer and support foster care.
I also wanted to talk about, for example, folks who could serve as child advocates in programs like CASA. Brenda, talk to us about how these folks operate, how they help, and how serving as a child advocate is different from serving as a foster parent.
Okay, so just so everybody is clear, CASA is an acronym for Court Appointed Special Advocates. These volunteers are trained advocates assigned to report to the court on behalf of children who are in the system for abuse and neglect. Our volunteers come from all walks of life, all ages, all diversities, with close to them or half of them working full-time jobs. Every CASA volunteer receives 30 plus hours of training and support from our local program staff who have professional backgrounds in the legal and welfare fields. We have continued to train and prepare volunteers to advocate on behalf of children and families, even during the pandemic. And actually, our numbers have all but doubled during this period, because I think people have had time to sit back and look at the ills of society and say, what can I do to help? So for those individuals who may not feel that they're able to foster, or many times, Clarkston, no pun intended here, many times it's the women in the family who want to foster and they're trying to convince their husbands. So for all of those people who can't, become a CASA, because you still are involved with children who are in the foster care system. You just don't have to take them home and provide for them 24/7, but you provide a valuable service for them. We've continued to recruit and train, again, using social media outlets, Zoom, Duo, all of those, FaceTime, all of those social media outlets have certainly been our friends during this time. So I say to people, if you want to do something, you can still make a change or help make a change in a child's life or in a family's life. CASAs are a little different, and we often talk about the fact that they are the one consistent adult present in a foster child's life. Once a CASA is assigned to a case, they remain on that case until that case is closed, whether that child is adopted, returned home, etc. We also are very different than the other players and foster parents because we're not paid for our services. And so very often birth parents are able to connect with their CASAs because it's like, oh, you're doing this because you care, because you want to do this. They find that amazing. So we have found that we are able to communicate with them on levels very different than the foster care worker, the foster parents, et cetera, because many times they look at them as, why, you took my children away from me. And CASA comes in and says, no, we can help you navigate through this system. And so it's very different than fostering or being a foster parent. But I think you get some of the same satisfaction from both.
It certainly seems like there is a wealth of opportunity to volunteer to support youth at risk, whether you are an attorney, whether you're a social worker, or whether you're somebody that is at home realizing there's a problem and you have a heart and you want to be able to help. It sounds like there's lots of organizations willing to welcome you with open arms. I want to pivot back to something we've kind of touched on, but let's talk a little more about what we've learned over this past pandemic year about the role that technology has played and will continue to play in supporting families in foster care homes and also in staying connected with birth families. I guess I'll just toss that. Who wants to talk more about that technology aspect?
Well, I think that technology has been the glue to maintaining contact with our children and families during this time. For those of us who are not tech savvy, I think we have become more tech savvy not because of choice, but because of force. And so social media outlets such as Zoom allows you to be able to talk to someone and still see them face to face. It's not the same. And I mean, we know it's not the same, but I think it's a great substitute, or to be able to FaceTime. The key is being creative with how to engage children with these social media outlets. How do you get a 5-year-old to stay on Zoom to talk to anybody? a parent, a sibling, etc. So we've had to get really, really creative. It's like I have a volunteer who monitors one of the visits between the siblings, and then these are younger children, and so she has provided them with coloring books and crayons, so they kind of start out doing activities together, and that engages them. So you have to be really creative.
Jessica, you're certainly a living example in what you do, not only as a special education teacher, but then you're fostering youngsters as well. How will things be different going forward in those roles because of what we've learned from technology over this past year?
I think the expectation of being familiar with it, rising to the bar. If you don't understand technology, try and figure it out. There's classes I think the libraries offer sometimes. YouTube videos are always great. And I think it's something that it's not going to go away. It's something that has, like you said, has been a glue. And, this pandemic isn't going to go away, anytime soon either. So it's something that's an awesome tool to have in your toolbox that you can use to connect with people. And like Brenda was saying, you just have to be creative with it. And I have made so many green screen videos of me trying to engage those 5-year-olds to be like, look here. And same with like connecting with families. And, we've played games together with my families who are, out of state, and just keeping together, even though you can't be within the same physical space. So yeah, it's something, just keep learning and keep using it, because it's a great tool.
I know, Jessica, we're going to lose you to some classwork in just a few minutes. So before we let you go, as someone who has chosen to become a foster parent, tell us what keeps you doing this? What have you gotten, and what has this meant to you and to your husband, Tom, this experience?
This has been a very eye-opening experience. You come in to foster care, and you kind of have this mindset of, I want to help kids, help families, help community. And for us, it's been so great to see how resilient these kids are. So often you my mind is blown on how much they know, how much they can do, how awesome they are. And I feel it's been so much harder than we ever anticipated, but also you see how great your community is. Like prior to us having the boys, we got a phone call saying, oh, can you take on this baby and sister? And we said, oh no, we only want school age kids, because we don't have baby stuff. And they said, well, you can take a baby. And it literally within an hour, someone dropped off a crib. Another person, a coworker of Tom's, gave us a car seat. We had everything anyone could ever want. And I will never forget that to this day, of how much your community wants to be there, wants to support you. Like we've been saying, maybe foster care isn't for you, but loving on people, no matter who you are, it's for you. And it's just great to see how supportive everyone is. Everyone wants to see these kids succeed. So thank you, everyone, for all you're doing, and for you out there who are watching this. And I'm so proud of the community and how we're, trying to just make this place better for these kids. So thank you.
Thank you, Jessica. Katie, I want to turn to you and tap into your experience growing up in the foster care system from a very, very young age. And when you hear foster care being talked about, being reported about, what do you think people are getting wrong? I mean, what do you want us to understand about what foster care can mean to kids who are like you were once upon a time?
So I definitely have a unique perspective on the foster care system. My story didn't have a happy beginning, didn't have a happy middle. It did eventually have a wonderful ending, and I'm very grateful for that. But during that time, So I think when people are reporting and they're talking about foster care, sometimes we forget, there's like all these stats, right? And all these numbers and all of these, things that we definitely need to navigate the system, right? To see how things are going. But we often forget that those numbers are kids. They are people. They are, kiddos with feelings, real feelings that sometimes, like Clarkston said, are, juggling adult baggage that, at age 6, you shouldn't know how to have to cook for yourself, right? Or have to learn how to grocery shop at, a very young age because, your parents aren't there or things like that. So those are some things that I think oftentimes we kind of forget. And it's just like a nice reminder to keep in. I had a worker one time come to the home, and I had multiple workers at once, and she called me Ashley. That's not even close. My middle name is not Ashley. Like, first name doesn't even start with an A, and so I had to remind her, I get you have a case file, but I'm more than that case file, right? Because that case file probably says some pretty mean things about me because I wasn't the best child, and I do push your buttons, and I do want you to love me through that really hard time, right? But we have to remember that those little things will stick with you for life because you're going to remember that you had a worker come in and call you Ashley, right? And you're not even close to Ashley. So just remembering those things that, they're kiddos too, and that just kind of remembering that, we have all these numbers, but at the same time, we need to remember that this is what we're doing for them, and just kind of also listen to what they want and understand that they can advocate for themselves too. And sometimes they're the best advocate that they have, right? And so taking that moment to listen to them means more to them than anything that you could ever do for them.
Beautifully said. We've got to turn to some questions in the time we have left because we do have them. I'm going to start with a question that's been sent in from Nancy Lewis, who notes that children with disabilities have had a particularly tough time during this pandemic in Michigan. Children with disabilities don't have access to their entitled Social Security payments. The monies are held at the state level. And she wants to know, what is Samaritas doing to get children with disabilities the specific Social Security payments they're entitled to receive? And how can we help in these efforts? Jennifer?
I don't know if Stacy can really answer that question better on the state level, but certainly we have children that are coming into care with very special needs, very unique needs, and I just want to make a plug that we need foster families to help them. A lot of times, again, it's scary to become a foster parent taking in a child that you don't know. And that doesn't know you, that comes in with different values and with the trauma. But there's also children who have very special needs that need a very special family to take care of them. So, we do have ways to navigate through the system with medical care. We've got a staffed doctor at MDHHS that we coordinate with when we have special needs that can help us navigate that system.
Stacy, what about that question about the monies being held at the state level, their Social Security payments?
Yeah, I know that we're probably all aware of the NPR. I think it was NPR, national news story on that. The Social Security Act does allow for states to offset the cost of care by using those other entitlement, if you will, or benefits, financial benefits. That children receive. And oftentimes they are held in an account and then provided to the family or the child. And sometimes they're used to offset the cost of care. But we are looking closely at our policies in Michigan. I know just last week there was some meetings scheduled that I won't be attending due to my retirement, but others behind me will be attending too. We want to get kids all of the supports, financial included, that they're entitled to and deserve to have and should have access to, whether it's when they turn 18 or whether it's support for their family. So we're looking very closely at what our policies are and what might need to be changed to make sure that we meet the needs of our kids in care.
Andrea Goering has a follow-up question to what we were talking about, Brenda, with technology. And you very aptly put it as kind of the glue holding things together. And Andrea's question is, what about the families that don't have computers or access to the internet?
Yeah, we know that that's an issue for everyone, not just children in the foster care system. But I can say that our CASAs have been very instrumental in working with foster families or relative caregivers in securing tablets, computers, et cetera, through the school district for the children in their homes, especially since, of course, we've been relegated to remote learning for most of this year. And then they also look for hotspots, and they get creative in terms of how they're able to connect these families to the internet. And I think we've had to be, or our children are going to suffer as a result of us not putting on our thinking caps and thinking outside of the box. And sometimes we've had to do that.
Another question from Andrea Gehring, and this is kind of aimed at Stacy. She was wondering how can you be positive about low placement numbers when the pandemic has proven how difficult it is to identify issues that are happening when the doors are closed. So many kids are missing from that in-person instruction in school. How can you know what's really happening at home?
Yeah, and we can't. And I mean, that just going through the pandemic shined a light on that fact. We can't. And unfortunately, we get the call after a crisis, oftentimes. And so that's why when I spoke earlier about the need for all of us to assist families who are struggling, who are facing challenges, who are in, inordinate times of stress, perhaps. Because the government is not going to be able to do it effectively if our aim is to prevent maltreatment in the first instance. And so we need to build a system. We need to rebuild a system, not the one that we currently have, but one that actually serves families in a meaningful way before maltreatment occurs. And that doesn't look like tweaking our system. It looks like pouring money that we use for out-of-home care into our front end. Into prevention services. And I'm happy that the governor advanced in her budget this year a request to the legislature for state dollars to do that, both in terms of expanding home visiting programs, which are evidence-based in Michigan, as well as other evidence-based services to address parenting skills, substance use, mental health issues for our families. These are real things that our families are experiencing. And gosh, what we could do if we redid our system so that we offered those supports much, much earlier to prevent. So I'm not sure if that answers the question entirely, but boy, I hope that Michigan continues to head in that direction.
And we know foster care and adoption is on the minds of lawmakers. Earlier this year, the Michigan House formed a bipartisan adoption and foster care task force. Jennifer, what can and should the state do to better support the mission of organizations like Samaritas and support our foster parents, our kids in the at-risk birth families?
Well, we need to recognize that this is an issue in the first place and that it does cost money to do this. And we work on very little money in the child welfare system. And I know that, like Brenda had said, people have this perception that agencies and foster parents are making money off of these children and families, and it's really just a perception. Foster parents are reimbursed a portion of what they spend on the children to help take care of those children, to ensure that they're able to meet the children's needs. And foster care agencies are spending every dollar that they get, pouring it back into the families that we're working with. And some of that is overhead costs, having to employ staff to do that. But we try to put as much money as we can into those families to support them. So first, there needs to be an acknowledgement and the appropriations to be able to do the work to keep these families together. As Stacy and I have mentioned a couple times, preservation services are vital, and the state is leaning towards that approach to helping the families. And so I think we need to recognize that there has to be those supports, that the community really needs to be provided an opportunity to help support children and families before they come into the system. Yeah, that's what I'm thinking. I had another thought and I lost that thought, but there's a lot.
No, there's a lot there. Absolutely.
There's a lot there.
A question from Kim Marshall wanted us just to recap, Stacy. Again, how many young people are waiting to be placed within a home in Michigan, which leads me to ask you to recap that. And also, what would be the first step if someone watching this is inspired to become a foster parent? What's the first thing he or she should do?
So we certainly don't have a waiting list, because as soon as children need to be removed, we have a placement for them. But we don't have enough homes that will take siblings, big sibling groups. And we always want to keep our siblings together and not separate them. Kids have told us that the trauma of removal is hard enough, but now you took me away from my brother or my sister, and they had no one. So that's critical. Also, we need homes for our older youth, for our kids, our teens coming in, perhaps, as Jennifer mentioned, our kids with disabilities. We're always looking for homes for those children as well. So we don't have a waiting list to place kids, but we do have kids that are waiting for an adoptive home. And the 200, 300 number sounds about right for kids who are not yet matched with an adoptive family, and they need an adoptive family, a forever home. And so we are still looking for adoptive parents, for sure, for those kids. If folks are interested in getting involved in whatever way, maybe it's as an adoptive foster parent, or maybe it's in a different capacity, we do have a 1-855 MISH Kids number that you can call, and that's a statewide number, and you can express your interest and they'll point you in the right direction. Again, that's 855 MISH Kids. And let them know what you're interested in getting involved in doing.
We have just a few moments left, and I'd like to give each of our panelists a chance just for a parting thought, something you maybe wanted to say and didn't get a chance, or an appeal to the people who are watching. And Katie, I'm going to start with you, parent recruiter.
Yes. So, thank you for attending today. And if you, feel the need to help in whatever way possible, we talked today about how there's many options about foster care. So if you ever feel that you want to help in any way, even if foster parenting isn't for you, feel free to reach out to your local agencies. Definitely need help in every single way. And so we're going to be there to welcome you with open arms, and just thank you for, wanting to help kiddos.
Clarkston.
Thank you. Yes, one thought that came to my mind that I didn't get to mention was the value and impact of fathers, fatherhood in our children. I very much understand that most adoption or foster care situations are with mothers. But if there's men that are watching, to ask yourself the question, I don't know, man, I don't know. Let me empower you and say, these boys don't know what a true man is, because most fathers are not in the picture. And most mothers are overwhelmed and they can't do anything else. And that's why their children are taken. They need a strong man to be able to see that image. And I employ that fathers need to be there, to be in the picture and show them what it is to be loving. That is not to hit someone to show love, but to hug someone, to show the impact of what that means to them. Things that were done to them that said they love them, they have to show the reverse. And it needs to be a strong man that says, when I love you, I hug you. When I love you, I speak life into you. Not I love you, I smack you. And these are the things that more of our system needs. And we need to empower the fathers that have lost their children and say, you can get your sons and daughters back. Don't make just child support the issue that you settled for. Look to get your children back. Let's get you a job. Let's get you a suit. When you go to court, I want you dressed nice to show the judge you are prepared to get your children back. Let's get you housing. Let's get the resources you need, because it's not just about to say, great for your reunification and family preservation, definitely needed. But I'll say just as much, if we're going to get these kids out of systems, it's telling men, hey, we see you doing better. We see that the brokenness you may have had, that you didn't have a father, you can stop that right now. You can stop that generation issue, and you can be the change these boys need to see. So,
Stacy, quick thought?
Yeah, I just want to recognize the grace, the resiliency, and the hope that I witnessed at a state level in the past year, whether it was our biological families, our caregivers, or our youth. Just incredible. or our caseworkers who are doing very difficult work every day and didn't get a chance to be remote because they're essential staff out there in the field. So I just want to recognize that, and particularly our families of color who were not only disproportionately hit by the pandemic, but also had to endure in a real different way than I think folks who are white did. The violence that we all witnessed over and over again nationally, which really can be traumatic for so many. So I just want to say grace, resiliency, and hope, and I appreciate everyone.
And we should say happy retirement to you as well. Thank you. Brenda, final thought?
I think that foster care, as we've stated, is the most rewarding yet the most difficult thing that any of us have probably done. I believe the call to action is the community responsibility to our children. And I too, Stacy, believe in hope. I think hope is believing in the light, even in the dark. And to me, it's believing in better days, even in your worst. I would like to think that children in foster care get to experience the ultimate hope. They get to hope for a restored family, hope for better days, or hope for a brighter future.
And Jennifer from Samaritas, final thought.
Yeah, well, this month is Foster Care Awareness Month, and actually today is Foster Care Awareness Day. So it is just really important for the community to be aware of foster care and the need to support the children and families. And the first step is to learn more about it. So I applaud everybody that participated today, took some time out of your day to learn more about the foster care system and what's going on in foster care in Michigan right now. I'm going to reiterate, I think what I've tried to kind of push this whole time is that we need the community to step up. We have the professionals, but we need more professionals in the field too, actually, but we need the community to step up and offer what they can to support these children and the families. And again, not just the children, the families. These families are going through very difficult times. They're going through struggles, and then their children are taken out of their care, which just makes it even more difficult to overcome the struggles that they're having. So they also need to be wrapped around and taken care of during this time. So any way that you can support these children and the families and the organizations that are providing the services is welcomed. So we can be creative, use the tools that you have to help support. And again, as a foster parent, both Jessica and Clarkson and I have talked about needing the support as foster parents. I have like 9 people on my official list of supports because it is so important. And even though my agency says, you don't need this many, I say, yes, I do. I need at least this many. It's so important to support foster parents. So if you do know a foster parent, offer your support to them. Even we can connect you with a foster parent if you want to do that, but the foster parents need your support. So thank you again.
Well, thanks to our wonderful panel for all that you do, because it's very clear this is so from the heart. You care. This is not a job. This is not rote. You clearly care, and it shows in everything you say. We want to thank you for caring for the kids and for what you do, and for joining us today for the State of Foster Care 2021 Town Hall, hosted by Samaritas. And we want to thank all of our viewers who've shown an interest in learning more about and supporting foster care needs in Michigan. If you've got additional questions, you want to offer the support that you've heard asked for, we encourage you to go to samaritas.org and find out more. And also, everyone who pre-registered, you will get a follow-up email that will provide you links to resources. So you won't have to go digging, it'll be right there. So that does it for us today. I'm Cynthia Canty for Detroit Public Television. Thank you so much for joining us, and I hope you have found this hour inspiring and informative. Thank you so very much.